Hi folks, this is Tamir Virani from Frayme. I'm the Senior Marketing Communications Lead. Thank you so much for joining us today. We're going to get started, I believe. So without further ado, I'm going to pass over the reins to Shauna, our Executive Director, to kick things off. Thanks.
Thanks, Tamir, and good morning, everybody. Thank you for being here. It feels a little strange. I can't see anyone on the video camera, but I hope everybody is doing well, and thanks for tuning in. We're here today. We have Dr. Tanya Halsall with us. We're talking about the social network, examining partnership development to support knowledge translation in youth mental health. And I'll just ask for the slide advance, please. Perfect. So I want to start with a land acknowledgement. Obviously, we're doing this virtually today, but we would like to begin by acknowledging that the land on which Frayme gathers is the traditional unceded territory of the Algonquin Anishinaabe people. Advance, please. And just a little bit about myself. I'm the Interim Executive Director for Frayme. I've been with Frayme a few months now, but have been working in large-scale system change for children, youth, and their families for many years. And we just wanted to take pause before we begin and sort of delve into sharing and learning with Tanya today, and just get a sense from people about how you're doing. We recognize that it's challenging times right now. We're in this shared global pandemic, and we recognize it's not easy for people to carve out an hour and a bit of their time to come and learn and share, and so we greatly appreciate you being here. But we'd like to just do a bit of a check-in. And so in the chat box, if you can open up your chat box on the bottom of your Zoom window, and to all panelists and attendees, maybe just share how you're doing, say hi, just so we can take a moment to connect. And I'll give people just a moment if they want to say anything. Oh, we have some people from Nova Scotia. Hello, Alicia. Toronto. Oh, hi, John. Thanks for joining today. Some people are saying some days are better than others. The news sometimes is a bit challenging. Typically not all good news. Hi from France. People feeling grateful, sending messages of support, feelings of worry. Some people trying to deal with and navigate the challenging move to a virtual world, especially for work. And today, both Tanya and I are sort of juggling that balance as we're home with families and work as well. So definitely understand some of that challenge. Yeah, lots of feelings of worry. And also balance that with gratitude for connectedness and trying to find some balance in the new world that we're working within and living within right now. So I appreciate that people took a moment to share, and please feel free throughout the conversation. And I don't want to speak for Tanya, but I'm sure she would say the same thing, to just share if you feel through the presentation that you'd like to keep saying hi and connecting with one another. We would absolutely welcome that. And along those lines, I'd also say thank you for advancing that throughout the presentation and the conversation, there will be a Q&A at the end. I'm going to moderate the question and answer period for Tanya. So throughout the presentation, please send in your questions to all panelists and attendees. And the Frayme team, Miriam and Tamir, are going to collate all of your questions so that we can ask them at the end. So please use the chat box as a form of communicating some of your thoughts and your questions for Tanya as we move through this. Thanks, everybody. Thanks for continuing to share. So I'm just going to talk a little bit about what Frayme is and our vision and really what we're trying to do. And then I'm going to very quickly turn it over to Tanya because she has sort of the more exciting things today that we want to learn about and share and kind of converse about. So what Frayme is really, and I would say that in the context of what we're collectively going through, the concept of a global community is really hitting home for me very acutely lately. And so, so is the concept of mental health and mental wellness. And so really trying to ensure that young people have access to the help that they need when they need it in a timely way, and that it's a type of service that they need seems more important now than it ever did, and it was always a very critical piece. So the acuteness of that need, I think, is really becoming globally clear. Our mission is really as a national and international network that connects providers, experts, young adults, scientific researchers, service providers, and others across the world to share and learn together. And it's really around the implementation of integrated services for young people. You can see here our focus, the focus on IYS, or the integration of youth services, and I'll talk a little bit more about what that is. And we really try to do that through stakeholder engagement, again, so the diversity of stakeholders that are informing this work, guiding this work, knowledge synthesis, so really pulling sort of all of that evidence that exists from all of the different expertise and forms of evidence in our world, and pulling that together into something that's digestible and applicable. Knowledge mobilization and implementation, so taking all of that great evidence when we have it and we've collated it and moving it to action and bringing it to the people that are really doing change work in their communities so that they can use it in a timely way and apply it to practice. Global leadership, and I would say that that's really evident through those that are on the call today, the webinar today. We have people from around the world, and you'll see as we get to the Frayme sort of plotting map that really this is a global initiative. There are people around the world working in this way. Frayme is one of them, a leader in this area, as are many others. And partnership development. So really working together and collaborating together to mobilize this knowledge and implement it so that we can see transformation of the system and enhance outcomes for youth and their families. And so what is Frayme? And we really see our role as trying to tie all of those pieces together. To share and make use of what we already know, or what we know works, or what we think might work, to support that evidence generation, to help those that are implementing. Again, bringing that knowledge to practice so that they can put it into practice, that it's timely and that it's responsive to their needs. So really that responsiveness is a piece that Frayme really endeavors to deliver on. To establish and maintain partnerships, so we're investing in partnerships over time, and we're growing those partnerships and maintaining them in a way that's mutually beneficial approach and beneficial relationship, so that again we can all ships rise. We want to ensure true system change, so true system change being based and focused around listening to what people who use services tell us they need, and then putting that into practice in a way that we evaluate, we improve over time, and we understand. And that's part of my excitement for having Tanya here today and really having her share some of what she's done and what she's learned. To assure alignment across jurisdictions, so really trying to ensure that those pockets of excellence and best practice are being scaled up and spread out. And to evolve the knowledge base collectively over time. So as we learn together, we grow together, we change together. And pieces that work now or are timely and responsive now may need to evolve as the system around it evolves over time. And so we acknowledge that and we endeavor to deliver on that. Advance, please. Thank you. And so what are integrated youth services? And really at their core, integrated youth services are holistic services that work together, that are seamless, accessible, that are service matched to need, and that are built around a young person and their family. And so you can see here, we have some examples of services that would be part of that holistic service provision model: mental health services, substance use services, primary care, vocation, education, recreation, navigation, housing. One piece that I would say is definitely an emerging area of expertise is peer support. So we need to get that on here as well. And there may be many others that are sort of woven into this depending on the context. And there may be a piece here as well around cultural services or a culture-based service model, depending on location and diversity of population and who you're serving. So this just gives you a little bit of a sense of those around the globe that are working in this way or endeavoring to work in this way. This is an interactive map on the Frayme website, and you can go on and you can also plot the work that you're doing if you join the Frayme network. So there's 383 sites so far that are plotted, probably many more around the world that are working in this way that we want to connect with and learn from. And so again, this sort of global collective learning, I think we can really see here how this is a global movement to transform youth mental health so that we're really meeting the needs of young people in an integrated way. And I think now more than ever, the concept of global connectivity and learning together and implementing system transformation together hits home more now than it ever has before about really, there are more things that bind us together. And so what does the Knowledge Mobilization Network do? And really, I would say that the overlay to all of the work is really evaluation or ongoing quality improvement and understanding what works, what's responsive, what's of value, and doing ongoing evolution of approach so that we can meet that need. The partnerships of the network, they both guide, learn, and utilize and inform the work that happens within Frayme and the concept of knowledge mobilization itself. So here we can see really that understanding of evidence. And at Frayme, when we talk about evidence, we really talk about holistic evidence. So we're talking about the expertise of lived experience. We're talking about scientific research evidence. We're talking about service practitioner or practice-based evidence. And we're talking about sort of other forms of evidence that we learn about over time that inform this piece. And that's a bit of an iterative piece. So evidence sort of informing integrated knowledge translation or the development of knowledge mobilization, and then that being put into practice as we talked about in that sort of timely way. And that's really what drives impact or system transformation specifically. And those who produce knowledge use knowledge, and those who use knowledge produce knowledge. And so really what we're trying to articulate here is that everybody is a knowledge producer and everybody is a knowledge user, and that sort of integrated and synergistic relationship is iterative over time, and we learn from one another and we inform the work collectively. So I think that really speaks to the value add of having all of us here today, both to learn but also to share. And so again, I would really welcome people to share in the chat as we move through this so that we can continue to learn together. And with that, I'm going to formally introduce Dr. Tanya Halsall. It's our pleasure to have Tanya here with us today. She is a postdoctoral fellow at the Royal Institute of Mental Health Research. She received her PhD from the School of Human Kinetics at the University of Ottawa, and primarily she's focused on positive youth development, mental health promotion, and examining initiatives that apply ecological approaches. And she's been involved in evaluating system-level initiatives, including Frayme, for which we are very grateful. And so Tanya, I'm going to pass it over to you, and thank you for being here.
Thank you, Shauna, for the introduction, and thanks for having me for this presentation. And thanks to everyone for taking the time to participate in these unusual circumstances, and we're very happy to have you. So I'll just go over the learning objectives first. Essentially, this webinar is focused on partnership, and we also talk a little bit about knowledge translation and system transformation related to youth mental health promotion. The majority of the presentation is based on a social network analysis that we completed over the last year and a half that involved Frayme partners and looked at exactly how things have evolved over the last few years. We'll review findings that we collected during that social network analysis and sort of walk through the lessons learned and strategies that we used, and we'll demonstrate how you can apply these methods potentially to other collaboratives that you're working in, as well as integrated youth services, if that's of interest. So I wanted to begin with a poll question just to get to know how long folks have been involved with us, and also how well we're known, and what people know about Frayme and what we do. So the question is, how long have you been connected to Frayme? Or how long have you known about us? How long have you been working with us? Since the beginning. So we were formally announced in the spring of 2017. So that was about 3 years ago. Between 1 and 2 years, between 6 months to a year, since the Learning Institute. So you would, if you were at the Learning Institute, then you would know that was about a month ago. And some of you may not be very familiar with us yet. So the last option is, I still don't really know what Frayme is. And today's a great opportunity to learn more about what we're doing. So I'll give you a little bit of time to select your response. Not something you have to think about for too long, I don't think. But definitely helpful for us to know, who's in the audience today. Okay, so a lot of new folks, people who are still learning about what we do. A few of you around since the beginning, and sort of, yeah, I'd say sort of about half who've been here from a few months to up to 2 years. So thanks for facilitating that, Tamir. So this presentation is based on 2 bodies of knowledge, one of them being our early lessons learned. So I'm currently a postdoctoral fellow at the Institute of Mental Health Research. And the Institute of Mental Health Research is as part of the Royal Ottawa Hospital here in Ottawa, and Frayme is actually being hosted within the Institute of Mental Health Research. So I helped to bring Frayme together in its very early days. So even previous to the spring of 2017, we developed an application to the Networks of Centers of Excellence of Canada for an international knowledge translation platform initiative. And we started working on that in the spring of 2016. And so a lot of the lessons learned around figuring out how to bring people together, how do we get organized, setting up operations, conceptualizing how the advisories are going to work, performance management. I was involved in a lot of those sort of early plannings. So some of these lessons learned have informed this presentation. I have not been Frayme staff for about 2 years. So these are all sort of the foundational kinds of sort of lessons that we came across over the last over the first couple of years of getting established. But in addition to that, the information is based on a social network analysis that we completed about a year and a half ago. So we collected the survey in the fall of 2018, I believe, and started looking at the findings last year. And so the majority of the details and the findings are from this publication that came out on March 7th, examining partnerships within an international knowledge translation network focused on youth mental health promotion. And so some of you, depending on when you became involved, may have actually participated in this social network analysis. So thank you to those who did actually complete the survey and provided your insights and perspectives around the collaborations that we're doing. And this is an opportunity for us to share back with you the information that you provided in the context of the work that we're doing and the perspectives of the other partners. So this was actually the first time that I conducted social network analysis. So I don't have a ton of experience with this kind of methodology. I'll try and answer as many questions as I can, but this is quite a large field. And so we may have to get back to you on some of your questions. But on that note, the methods that we used are quite accessible. And I'll describe them to you in a little bit, but we use the partner tool. And it comes with a whole suite of sort of tutorials and supports. So what we've done to examine the partnerships within Frayme, I think that approach is quite accessible probably to many of you who might be interested in applying it yourselves. So just one other poll question before I get into the information. Did your organization participate in the social network analysis? And so we had organizations participate, but we also had individual researchers and our advisories. So obviously, if you were an individual and you filled out the survey yourself, you would know. But if you're part of an organization, and in particular a bigger organization, you may not actually know if you participated in this social network analysis. You know, there's turnover and things like that. And so it's kind of, I'll speak a bit more to figuring out who represents organizations and who provides perspectives, but you'll see that it's quite a complex sort of a strategy. Give a few more seconds for people to respond. Okay, so some of you, but a lot of you know, and some of you not sure. Yeah, like, I mean, there was a lot of organizations that would be, you know, more than 50, 100 staff, or hospitals. And so they may have participated, but certainly the, depending on who filled out the survey, the perspective is quite different. I'm not sure, I'll close this, okay. So next I want to speak a little bit about partnership in general, as well as knowledge translation. So why be a part of a partnership at all? There are probably many, many different benefits that are related to partnership, but I would say like a generic and probably ubiquitous example is that you're leveraging resources and sharing skill sets. So you're able to do much more with less funding and less resources because you aren't reinventing the wheel. So for example, when Frayme came into the Institute of Mental Health Research, you know, they came into their HR, they came into all their IT, there was offices, you know, Frayme didn't have to start from scratch because of that partnership. And there are many, many other examples of ways that you can partner, sharing, you know, potentially there's like really strong communications within one organization that can be shared, or there's research findings, or whatever the case may be. Partnership certainly can make initiatives more efficient and effective when people are working together. In our context, because we're doing knowledge translation, and certainly in research as well, when you mix disciplines, you also have the advantage of, you know, taking novel theory directions and moving them into new areas, or bringing new methods into other areas and coming up with innovative solutions that probably wouldn't have been possible if you were staying within a field or within a discipline or within a sector. And then you also have much more coordination around how do you tackle difficult challenges or wicked problems, or however you want to define them. You can align research with policy, with practice, and actually have coordinated responses to you know, health challenges and other kinds of social issues. So there's, you know, I think the list can go on and on and on, but partnerships certainly can deliver a lot of advantages when you're working within the health system or within other areas of social services. Now, partnerships don't come without issues. I think, you know, depending on the day, things will work really well, and on other days they won't. So within partnerships, you can see interdisciplinary challenges, power differentials, you know, tensions related to resources. Then there's just the nature of working with people. Some people are shy, people have different communication styles, some are more flexible than others. I was at a forum the other day participating with Gord Gardner, who's the executive director of Community Addictions Peer Support Association. And we were talking about partnerships and collaborating, and you know, we may all have the same goal of promoting youth mental health and the same, you know, outcomes that we're working towards. But he said on sometimes and some days, I just want to be right. And it's quite true that there's oftentimes people will butt heads around exactly how to do things. And so partnerships foundationally are about relationships, which require work and, you know, go through different ebbs and flows. I also wanted to share this diagram of the bioecological model as well, because we're doing partnership with a focus on youth mental health promotion. And I think if we're going to even have a slim chance of affecting youth in a holistic way, we need to be looking at the youth as a whole individual, including their strengths and weaknesses and, you know, character traits and the whole individual, as well as their contexts and the range of social determinants that influence them. I think it's human nature to sort of be reductionist and try and isolate things. And a lot of our services are often focused on, you know, one kind of issue or one kind of population, or potentially have like a mandate that is very outlined. And, you know, in doing so, it's hard to create big impacts for individuals because there are so many other aspects of their life that are influencing them at the same time. I was speaking with one of the family advisory members at Frayme a couple of years ago, and she was talking about what among, I guess, family advisories or family advocates, they call the 23.5 hours. And so she was talking about how, you know, youth are with clinicians or with services for, you know, potentially half an hour out of a 24-hour day, and the rest of the 23.5 hours, they have them. And so looking at it from that sort of time use and dose of context, you know, you really need to be looking holistically at everything. And, you know, looking at what their school environment's like, looking at their peers, their home and family, their neighborhood, you know, as well as, sorry, there's maybe a little bit of noise from my children in the background. Apologize. So for example, parental workplace, the children often don't spend a lot of time there, but if you have parental income that is, you know, potentially limiting the income of the household, that's going to create a big influence on the development of the child. Job stability, work environment. Does the parent get along with their boss, or do they hate their job? And this probably affects their mental health as well as the mental health of their children. And so thinking about all of these influences and how they affect child and youth development. Thinking about the coronavirus and you know, the recent changes in lifestyle that we're experiencing, you know, we sort of are seeing like certain contexts removed at this point, which is, I think, quite interesting. And we're all going to be influenced in quite different ways at this point, but you know, I'm working on a project right now that uses ecological approaches, and it's to reduce substance use. And I think particularly with the experimental stage, often it's in the peer environment that you see substance use behaviors because they'd be reinforced in that environment potentially. It's a culture that makes substance use potentially acceptable or desirable. And depending on whether parents right now are really enforcing social distancing or if youth themselves are imposing it on themselves, then you'll see, I think, these environments completely, you know, like, for the most part, they've been taken away, you know, other than going outside and standing 2 meters from other people. So we're seeing right now a huge influence from home and family, and also screens, which is peers, as well as, you know, the media and whatever other exposures we see within the social media environment. So the reason I brought in the bioecological model is that I think it highlights how integrated youth services really can have an impact on youth development and youth mental health. So many of the components of integrated youth services will influence different aspects of their environment. So you see school-based services, you have mental health and addiction services combined, technology-based services. So sort of environments that then reach out through through the online environment, so that youth can access using their cell phones or the internet, community-based access sites, as well as peer support services, family and youth engagement. So you really do start to see a accumulation of lots of different influences on the youth. And so these require partnership. Integrated youth services requires partnership among these sectors and these contexts. Knowledge translation. So we're looking at partnership within a knowledge translation context. And traditionally, knowledge translation has been defined as a process that ensures stakeholders are aware of and use research evidence to inform their health and healthcare decision-making. Traditionally, you would see within the healthcare context, it's sort of the bench to bedside kind of perspective. So mostly knowledge coming from research and then moving towards clinicians and practitioners and going towards practice. Similarly with implementation science, I think the focus has largely been on sort of how do you adjust guidelines and frontline service behaviors. But knowledge translation, as was described in one of Shauna's slides, all of the stakeholders become knowledge users as well as knowledge producers. And so you're looking also at practitioners, researchers, policymakers, consumer advocates, so in our case, youth advocates, and consumers themselves. So in the case of youth advocates, what kind of information would be important for them if, say, for example, they were setting up a youth advisory? So terms of reference, youth engagement policies, honorarium processes, this is all important information that they can use within their roles and is not necessarily targeted strictly at youth service delivery. Peer supporters benefit, and of course they also fall in line with, they fall under the category of practitioner, but learning about best practices around boundaries, self-care within service provision, and generating client engagement. These are all sort of evidence that's important for peer supporters to learn, and these are also youth. And then looking at consumers, so treatment decision making, self-care, and mental health literacy are all areas of knowledge that are important for the consumer themselves. So I thought I would put this little comic. Elise Gravel created this comic, as well as the one you saw earlier in the slides. She's a Canadian author and excellent about creating, putting together messages for children and young people that are accessible around current issues, life skills. And she created this comic recently. She posts them a lot on Twitter. And it helps to highlight that messages need to be accessible and somewhat concrete and not too scary, so that they can be digested for a younger population. Of course, this is for a younger population than youth, but just looking at us as consumers within a prevention context for coronavirus, I think all of us are right now frantically reading the news every day, not just because it's an anxious situation that we're in, but also because we need information around how do we change our behaviors? What are the limits on group numbers? How far apart should we be standing? What symptoms am I looking for? How do I disinfect the groceries? Every week there seems to be sort of new information for us to integrate into our lifestyles. And so, knowledge translation certainly goes beyond practitioners and policymakers. We're looking at how do you then change individual behaviors so that you promote health and mental health? And this was, I think this was one of the updates provided last week by the Prime Minister, and he actually included youth yesterday again, talking about Kids Help Phone. This I think made quite a difference for my kids who, mostly are annoyed with having to wash their hands, but to have the Prime Minister sort of step in and seemed as if he was talking to them and sort of acknowledged that this is a very strange state of affairs, but that this is a community collective movement that we need, and that children and youth are part of that movement as well. So moving towards the next section, I wanted to talk a little bit about social network analysis and what we did to look at the Frayme partnerships. So social network analysis is the study of relationships among social units, such as individuals, groups, or organizations, and the influence that they have over their overall network, or that grouping of people that you're examining. So it is always, you know, people or groups of people that you're exploring, and you're also looking at the interconnections among them and how they're working together. Often if you're doing social network analysis, but not always, you see network maps that look a bit like spider webs, where you have nodes or points that represent people or organizations, and then the sort of webbing or lines that connect them. And I'll show you the one that we created in our social network analysis in a moment. So I just wanted to briefly speak to the fact that this kind of research is absolutely in the complex realm. And I like this sort of analogy that I got, that is, I think, originally from Getting to Maybe, but essentially it contrasts how baking a cake is simple. You follow the instructions and you usually end up with the same outcomes, and it's not that challenging to come up with a cake that tastes good and almost anyone can do it. Then you have complicated, where you're building a rocket. So there are many, many more steps, and you likely have to have a specific expertise in order to be able to accomplish the end result, and likely multiple individuals working together to create the rocket. But then you have raising a child, where you have complexities of, you know, dynamic influences and uncertainties around whether what you're doing is correct. And there's a huge amount of diversity among individuals, and you know, you're working in the realm of subjectivity. So how do people perceive things? And so certainly social network analysis is within that complex realm. And I'll speak to a few reasons why it sort of was, you know, it felt that way for us. So first, just defining what a partner is. So, you know, at this point, you're all participating in this webinar, but many of you are not familiar with Frayme. And at what point do we consider people to be a network member, and when are they a partner? Does it have to be someone that we communicate with on a regular basis, or are partners, you know, do they have to have signed a formal agreement with us, or are they, you know, written into some kind of project where we are holding responsibility together? So it was difficult for us to frame, you know, who is a partner within our network. Another challenge that we experienced was defining what the network was. So, you know, when we first started to get established and realized that there was, you know, major partners who came together in Frayme who are already doing certain things. And, you know, the premise of coming together as a partnership is so that you can leverage what's going on. So who in the end claims credit for what parts? Like, what part is as a result of Frayme, or what part is as a result of an organization who's working in Frayme? And it really gets to be muddy waters around where you should or can draw the line. And so also thinking about, like, where is the origins of that project, and where is the beginning and ending of claiming credit for different outcomes. And then the third complexity that we encountered essentially was who should be filling out the survey to complete the social network analysis? So which partners are we including, and then what individuals within those partnerships? So, you know, you're always looking at actually relationships. And so, you know, what individual within the organization should be filling out the survey was kind of a difficult question to answer, because, you know, different people are doing different work with different partners, and you have a lot of turnover, and you have, you know, organizational history resting with only certain people, closer involvement on some projects than others. And it was difficult to finally identify what, you know, what individual should be the representative, you know, person to complete the survey. And, you know, how do they complete that survey? Like, should they be looking at interactions they've had only within Frayme projects, or, you know, past historical interactions, or, you know, potentially they were working for another organization for a while and have other perspectives that were generated ahead of time. So it was really hard to delineate, you know, who should be completing it, and what experiences should they be reflecting on, and what should they not be considering. So the purpose of the social network analysis essentially was to examine the level and strength of partnerships, to identify the strategies being employed to promote the main objectives of Frayme, which is to enhance the scaling of integrated youth services and to promote youth mental health in Canada and globally, and to apply the findings to current research in youth mental health and system transformation. And the way that we did this was with the partner tool. And so we came across the partner tool probably in the summer of 2017, I'd say. And we started to look into how you can apply the tool, and what is, you know, what are the related costs, what expertise do you need? And it was really a very viable and useful tool. Like, it was, so this is the organization that created the tool and promotes and supports the tool. It's called the Visible Networks Labs. And they have a bunch of sort of recorded webinars. So you can sort of look and see, you know, they talk about partnership in general and how they support partnerships and how to use the tool. They've revamped their website and their platform since we work with them. So a lot of things have changed, and I think they've probably expanded on the functionality of what they can do since we actually use the tool. And so I definitely encourage you, if you're interested in doing a social network analysis, to explore this option, because even coming down to troubleshooting when we were doing the analysis or running the survey, they were available to give like one-on-one support. They were quite good. And this is the sort of, I think, the sub page for the partner tool. And we didn't have this, I think this is actually an extra expense, but here's a little network map, and they're able to now have it distributed on a map, so you can see where your partners are and look at the network relationships overlaid over a map. But essentially, so the tool includes a validated survey that's implemented similar to SurveyMonkey. It's a web-based platform, and you add in all of your partners and questions and things like that. And then it also comes with an analysis software, which is essentially, when we were using it, was macros embedded in Excel. So really not inaccessible software in any way, and definitely something that most people can become familiar with. So the survey includes questions, like they had general questions about motivation for participating in the network, what are your resource contributions, length of time of involvement, the nature of contributions to the network, your perceived level of success of the network, and also major outcomes. But then there were also relational questions. So you had to, if you were completing the survey, you had to essentially talk about how you were working with all of the other partners. And so looking at things like frequency of interaction, perceptions of trust and value, as well as level of collaboration. And so, you know, as you looked at the list of Frayme partners, each respondent had to look and see if they were partnering as well with other partners within the network. So myself, the scientific director, and the director of operations sort of sat down and talked about who should we include in the survey. And so this would have been about a year and a half ago. And essentially, we decided to include partners if they were familiar with our mission and knew exactly why we were, oh, I forgot to advance the slide, sorry. Why we were doing this work. And they had to have some knowledge of the work that we had accomplished up to that point, so they could reflect on different projects and forums and presentations that we had given in the past. And this was a bounded survey, meaning that only the people that we invited to participate could actually complete the survey. So we sent it out to 75 different partners, of whom 51 responded and completed the survey. So we had a 68% response rate, and that was with me following up. I did at least like 2 or 3 general follow-ups. And then there were some folks who, like very, very key stakeholders that I followed up with like a few more times because their insights were quite important. And yeah, so among those partners, there were researchers, there were organizations in system transformation, and we created these categories. So we sort of looked at all of the partners and decided where they fit best in terms of their own vision, mission, and what kind of work they were doing. And system transformation essentially included organizations that were doing similar work to us. So promoting knowledge translation, partnerships, bringing evidence into practice, and not doing, service provision or pure research per se. Maybe doing some work in those areas, but primarily they were supporting other organizations in strengthening the system. Then we had practitioners, actual integrated youth service sites. So these would have been like backbones completing the survey, policy, people representing policy, philanthropy, our family advisory. So we had only one network representative for family and youth, although both the youth and family advisory, as well as some of the other organizations, had multiple people fill out the survey, because recognizing that different people have different experiences and partner on different projects, it was easier to sort of get a holistic capture when we had more people from one organization or advisory group complete the survey. And then we had one media as well. Samir, should I pause at any point or just continue on through the rest of the presentation and hold off for any, is there anything pressing that anybody would want to ask?
Not at the moment, so we can move on and then save the questions for the Q&A.
Okay, I'll try and be efficient because I know we're running out of time here. So this is our network map. So all 75 of the partners that we sent this survey to are included on this map, even though not all partners completed the survey. So even if they didn't complete the survey, other partners would have rated whether they were working with them. And so they get connected into the map anyways. So each of the circles or nodes is one of the partners who were within our survey respondents. And the lines represent that at least one of the partners indicated that there was a relationship. So when you got to the relational questions, the first one essentially was, do you have an established relationship with? And then there was the list. And that was another challenge we experienced actually, because some of the partners actually had to complete like the relational questions, up to 50 times, because they also were working with a huge amount of our partners. And so that's really time consuming. And so they were doing a big favor in completing this survey for us. So then from, do you have an established relationship, going through the relational questions, then they would say, how often are you working with them? What's the level of collaboration that you have with them? So the network map essentially is created using like a Spring algorithm. And this dictates where the nodes end up. So the rule of this algorithm is essentially that if two things are connected, bring them closer together. And if they're not connected, push them apart. And so all of the nodes that are closer to the center have more interconnections with other partners, and the ones that are further out may have only 1 or 2 connections. So if you look at this network map, I'll actually tell you, so number 72, that's actually the Frayme Secretariat. So Frayme, we selected all of the partners. So we had a connection with each and every partner within the survey. And then when you look at the group key, the practitioners are in red, integrated youth services sites are in purple, researchers in green, youth are in yellow. So youth were actually, so that's the youth advisory right close to the middle. The family advisory was a little bit further out. And in part, I would say this is because the family advisory started up a little bit later. And so the youth advisory had laid a lot more groundwork at that point. System transformation was brown. So there actually are, most of the system transformation people are sort of in the center here. So they had a lot of interconnections with other folks in the network. And then policy, media, and philanthropy. So the density, the overall density score of the Frayme network was 20.6%, meaning that of all of the possible interconnections, about 1/5 or 20% of them had been made. So there is a lot of density that can still be created in the network, although, you know, more density doesn't necessarily mean better partnership. In addition, the Frayme network is very centralized. So which means that the network, rather than being more diffuse and having sort of looking maybe more like a web, it looks a little bit more like, it has more radiation from the middle. And so more central partners radiating out to other partners, like a hub and spoke kind of image, like a wheel. So another score that we were able to calculate was an overall trust score, which essentially represents partners' ratings of each other around whether they're reliable, whether they have mission congruence with the Frayme mission, and whether they maintain open and transparent communication. We also were able to calculate value ratings, which essentially is the perspective of each partner of another partner's value to the network in general. So at the time of completing the survey, the partner tool wasn't able to calculate an overall value rating. You only could have a value rating for each separate partner based on other partner ratings. And the Frayme Secretariat had a very high rating, as well as both advisories, the leadership team members, and one of the key funders, the Graham Beck Foundation, also had a very high value rating. And interestingly, most of the rest of the partners had low value ratings. And I'll speak to that in a few slides, because I think a lot of it is the result of the kind of a network that we are. So aspects of collaboration that contribute to Frayme's network success. So this was one of the results from one of the questions, which was what aspects of collaboration contribute to Frayme's success, and partners were able to choose all that apply. So at the very top, you see exchanging info and knowledge and bringing together diverse stakeholders. So essentially, you know, sort of lighter touch types of collaborative activities as more common, and then meeting regularly, collective decision making, having a shared mission and goals. These are much more integrated types of interactions. Those were less common. And you can see that also with the level of collaboration among partners. So, you know, in total, there were 691 total dyads of interactions, which meant that there were 691 connections, like, so lines between 2 points, which we would call a dyad. And among those, 11.4% there were no collaborative activities. 48% was cooperative activities, and cooperative activities would be exchanging information, attending meetings together, and offering resources to partners, but just sort of light cooperation, not doing anything too involved. 20% were coordinated activities. So that would be cooperating as well as intentional efforts to enhance each other's capacity. And only about 20% were involved in integrated activities with each other. And so that's cooperating, coordinating, but also having like sort of a unified, integrated way of working together. And so you can see that a lot of the partners we're working together, but not in an integrated way. And here's one of the questions asked: what resources were contributed by Frayme partners? And here again, we see mostly sort of knowledge translation types of resources, network connections, information and feedback, content expertise. You also see advocacy as being one of the major resources that were contributed, in-kind resources, facilitation and leadership, and these are becoming less common. So IT and web resources, funding, and fiscal management. Less often you would see people saying that that's something that they contribute to the network, which are much bigger contributions in general. So I have a couple of poll questions, and then I'll just go through the last slides quickly. So how would you describe your current level of collaboration with Frayme? And I think we're going to see a lot of none or potentially cooperative activities, since a lot of you are new to Frayme. So here's the definitions of the 3 levels or the 4 levels of collaboration that we looked at in the social network analysis. So you can sort of get a sense of, these are the kinds of questions that folks were asked about Frayme and how we sort of glean the information. So cooperative activities, sharing info and resources, attending meetings together. Coordinated activities are intentional efforts to support each other, and integrated activities as strategic alignment. And you know, depending on what scale you're using to look at partnership or collaboration, sometimes the top level is called collaboration, sometimes they call it integration. But if you're working in an integrated youth service kind of a partnership, you probably are working at that level and a lot more closely, a lot more, you know, sort of seamless processes that you've created around service provision. And so I think the poll results are coming to me. They're not up on my screen. I don't know if you.
Okay, I can read them out. So we have 74% indicated none, 24% indicated cooperative activities, and then 6% coordinated activities. And
Okay,
none,
for integrated, right?
Yeah, yeah.
Okay, thank you, Tamir. I think I have one more poll question really quickly. How might you as an individual or organization contribute to Frayme's work? So, you know, thinking about how you partner with other people, and you know, this isn't an ask in any way, but just so you can see the kinds of questions that we collected when we were doing the social network analysis, and thinking about how you work in other partnerships. This gives you a sense of those pieces that are relatively easier to share, and that can benefit yourself as well as other partners. So similar to the slide before, there's funding, in-kind resources, data resources, information or feedback, content expertise, methods expertise, network connections, fiscal management, facilitation, leadership, and advocacy. And Tamir, I still don't see the poll come up. I don't know if that's somehow stuck underneath my PowerPoint.
Yeah, I'm just, the poll's live right now.
Okay.
I'm going to
So it is
relaunch it maybe, because I don't think the attendees are seeing it either. One sec.
Okay. And if no, let's just continue on because we're sort of running short on time. Okay. So just give it a couple of seconds to.
There we go, yeah.
And Tamir, we wanted to end at 1 o'clock, right? For about 15 minutes of Q&A?
Yeah, exactly.
Okay, so I'll speed right through my last few slides then, once this is done.
People are answering it right now, so I'll just give them a couple more seconds and then I'll share them.
Okay. And so did the results come up again?
Yeah, can you see them?
No, they're not on my screen
Okay.
this time.
So we have 0 for fundraising, 25% for in-kind, 22% for data resources, 50% for info feedback, 66%, the highest one, for content expertise, 25% for method expertise, 50% for network connections, 0 for fiscal management, 16 for facilitation leadership, and finally 41% for advocacy.
Awesome. So lots of opportunities, I think, for potential partnerships with folks who are participating today. So thank you very much. I think that's the last poll question that I have in the presentation. So I just wanted to quickly talk a little bit about like reflecting on some of the findings that we collected in the social network analysis. So the value ratings were low for the majority of the partners, with the exception of the real key players in the network. And, you know, there's different ways that you can interpret that. I think in part, this was the result of the fact that we were early in our developmental stage. We were only, you know, a year and a half in, and folks didn't really know too much about each other necessarily. Also, the partner tool was developed to be applied essentially in public health context. So usually with partners all working in the same context and probably on a more frequent basis. And with a knowledge translation network, you're quite diffuse. You know, we have people from all across the world who may never necessarily work directly with other partners who are working in another context. So, you know, their value to each other may never be very high unless they have a very close relationship already, or they may have a very similar mandate, and it makes intuitive sense for them to partner together. And so with knowledge translation networks, you often see geographic proximity, professional similarity, and past relationship history influencing collaboration amongst members. And so, you know, maybe in KT networks, your value ratings are never going to be very high for everyone. But this also indicates that we can really raise the profile of different partners so that other folks can see what they do and what they potentially offer in terms of sharing resources and collaborating. So that's, I think, like an opportunity for Frayme in profiling partners to each other. Another finding was that the youth and family advisories ranked very, very high in terms of value. And so again, value is defined based on whether they're reliable. Oh, this is trust. So essentially whether they add value to the network. So this was important to us because, you know, within our philosophy, youth and family engagement is a major milestone and major foundation to our work. And so seeing that the partners also reflect those insights was reassuring. Finally, Frayme was identified as having very few redundant ties. So there's a theory called the strength of weak ties, which essentially hypothesizes that strong ties, which are defined by time commitment, emotional connection, and reciprocity among two actors, the higher the likelihood that there are redundant ties amongst those two actors. And when you have non-redundant ties, that means that link is a novel conduit for information. And so Frayme essentially had 66 out of 74 potential ties that were non-redundant, meaning that Frayme is a unique conduit that brings information from different sectors, different contexts to other places where they would never have been able to access that information previously. So in terms of future directions, I see social network analysis as being really useful in evaluating collaborations, both looking at processes and how they're contributing to how people are working together, but also looking at outcomes. And I think they can contribute a lot to grant development and specifically also to how to look at integrated youth services and how they're working together to inform, you know, both your own practice and to share with others. I think that's all that I wanted to say around our findings and the Frayme Collaborative in general. So we can go to questions and answers now. Tamir or Shauna, I think you were going to maybe potentially go through the chat box.
Yeah. Thanks, Tanya. So I'll facilitate the Q&A now. We have a couple of questions that were already posted in the chat box, but if anyone thinks of any as we go along, feel free to post them and we'll answer them live. So starting with the first question, someone was wondering, someone said it would be great to hear more about co-creating solutions products, which was identified in your article as one of the more frequent partnership strategies. So did these include formal co-design companies, consultants, or methodological processes, or more informal collaboration? And what types of solutions and products?
I can't remember that exact line from the paper, but most of our co-design, often when we're talking about co-design, we're essentially talking about youth-adult partnership, and how do we bring how do we integrate the youth perspective with the adult processes that are already existing. Yeah, I'm not sure. Shauna, did you have anything that you wanted to contribute in terms of that piece?
Tamir, can you reread the question for Tanya and I again, please?
Yeah, absolutely. So it'd be great to hear more about co-creating solutions and products, which was identified in the article as one of the more frequent partnership strategies. So did these include formal co-design companies or consultants or methodological processes, or more informal collaboration? And what types of solutions and products?
Yeah, it's a great question. And I mean, I don't think I'm in a position to be able to speak to sort of all of the historical ways that Frayme has co-developed some of the products, but I mean, I definitely can speak, and prior to coming to Frayme was a partner of the Frayme network from my position at CAMH's Provincial Systems Support Program, providing backbone support to integrated youth services. And I think there's a few ways, and we talked a lot about different forms of evidence. And so I think that co-creation is sort of more with both the people who are end users of the product, so have expertise or specific lived experience expertise, youth and their families, but also with service providers. So a lot of service provider co-creation in terms of in an iterative way developing products that would be put into practice. So not so much in terms of a consultant model, but within that is also sort of an expert consultant model or a key informant model. And so one of the pieces, especially for Frayme now and moving forward in the system more broadly, I would say, is really understanding what co-creation means. It's something that's actually fairly new and emerging, and Tanya, maybe you have some thoughts on this within our mental health and substance use system. And so the concept of co-creation and what that entails and doing that well, and understanding expertise from a variety of different perspectives to inform products is something that I think we're learning a lot about as a system and learning how to do that better. So I would say for Frayme historically, more sort of with partnerships across the network in the concept of co-creation. But again, I think the concept of co-creation more broadly for mental health and substance use is expanding, and we're learning a lot more about what that looks like broadly for the system. Tanya, do you want to add anything?
No, I think that covers it. I mean, from my perspective, I mostly work with youth engagement types of projects. So that's what I've seen primarily in terms of co-creation. But yeah, I think, as I understand, there is a specific model for co-creation. And for the most part, Frayme has followed youth engagement types of models in that arena. But as Shauna said, yeah, there's lots of different partners who are involved in co-creating products. So there are lots of different perspectives and diversity of perspectives that are involved in these processes.
Thanks, guys. I'll move on to the next question now, which is how are partners involved in co-creating the social network analysis survey?
Sorry, how are partners involved in co-creating social network analysis?
How were they involved in co-creating the questions, I'm assuming, on the survey, if they were?
So the social network analysis wasn't completed in a participatory sort of a way. There was myself and the leadership team and the advisories. I'm trying to remember if they were involved in sort of revising the questions. I mean, the decision to move forward was certainly a collaborative decision around, you know, the decision, you know, I'm forgetting now the name of the committee that sort of moves projects forward. Miriam, would you be able to help me on that?
Knowledge Mobilization Committee?
Yes, the Knowledge Mobilization Committee. I think they would have approved this for sure and probably provided feedback. But the question revisions, essentially it would have been the leadership team who provided feedback on that, as well as the Director of Operations and Scientific Director. But the partner tool, not all survey questions are, you can make modifications to contextualize the survey, but you can't change all of the questions. Some of them are relatively standardized, like pulled from validated surveys. And so there are only some pieces you're able to sort of tool around with.
Thanks. Our next question asks, in a social network analysis, how would you differentiate between a network and a directory?
I don't know. What is the difference between a network and a directory? As in like an inventory of people?
Yeah, I think that's what they were intending to mean.
Well, you know, this is just me hazarding a guess, but a network, you know, a network essentially is working together. They're having interactions with each other. But I suppose in a directory, you don't, you know, you make that list based on whatever the criteria of the directory is, I assume. Am I answering the question correctly? I'm not sure if anybody else would like to contribute.
Yeah, so we can move on to the next question. Maybe we can get back to the person who asked that with some more information after the webinar. So our next question is, and this might be more of a question for Shauna, wondering what strategies do you have for engaging players in jurisdictions that are not as far along in implementing IYS, or where IYS is not even on the jurisdiction's radar yet?
Yeah, it's a great question. I think that there's multiple strategies from a Frayme perspective, but I would also say that there's strategies across this network, and one of the strategies is really around sharing. So doing sort of what we're doing today, and the concept of knowledge mobilization and sharing out information and learnings. It's quite an endeavor to embark on implementing integrated use services, because not only are you sort of asking the system to work in a new and different way, but sometimes the systems and structures that are the contexts in which we're implementing integrated use services, or for some people they call them hub models, they're not set up in a way that is conducive or enabling for hubs. And so really what we're talking about is sort of system transformation on many levels, at a service provider level, on an individual level, at an organizational level, and at a system level. And so the implementation endeavor is quite complicated. To Tanya's earlier slide about sort of going from baking a cupcake or a cake to raising a child, right? And we're talking about system transformation being quite complex. And so I think there's a few strategies. One is asking and understanding what the community context is. What are the enabling factors in a community to support implementation of integrated use services? What is already existing in terms of partnership? And Tanya spoke a lot about this, about sort of value of partnership. What is already existing? So understanding the partnerships that exist, the level of collaboration and the level of integration of those partnerships is really critical. And using the strengths within the existing partnership to mobilize sort of that transformation of service provision. Another piece, of course, is utilizing your knowledge mobilization platforms, and that's really where we're hoping that Frayme can be of support. So learning from those that are already doing, what are the pockets of excellence that they're understanding, what are their learnings that they've gone through, from understanding the model or implementing a model, to understanding what it takes to implement it, to understanding how to build partnerships or strengthen a network, so that you can work in this integrated way, and scaling those. So the scale and spread piece, I think, is one of the ways that we collectively as a network and as a connected group of implementers, really, because that's what everybody's trying to do, is implement this, can benefit from the learnings of others, but also contextualize those. I think another piece that we're really hoping to be able to support the kind of global or collective system with is contextualization. So really understanding what works, but knowing that what works in one area or what has worked in one context might still require some contextualization to work in another context. And so really understanding, how do we go through that process of contextualizing something without losing the core components or the points of validation that make it a useful model that has outcomes associated with it. So I think sort of those concepts of knowledge mobilization are really critical, but also the bridging of connectivity. And that's really the strength of a network. And as Tanya spoke about today, the network can facilitate and bridge those points of connection. So I'd say those are some of the areas of focus and some of the areas that, particularly for Frayme, we're hoping we can both support others to leverage the network, create those connections, and mobilize that knowledge in a timely way. But that's the type of knowledge that we're hearing are definitely needs. And right now, a huge area of need for many of those working in integrated youth services is how to support virtually, right? So really trying to think about those pieces.
Thanks, Shauna. So I'm seeing now that we're at time, just a little 1 minute over actually. So thank you everyone who joined us today. And like we said in the chat box, if there were any questions that we didn't have a chance to get to, please forward them to frayme.info@theroyal.ca. And we'll get those off to Tanya to provide some answers after the webinar. And we'll also be sharing a recording of the webinar on our website, frayme.ca, in the next coming days. If you're subscribed to our newsletter, you'll get a notification when that is live. And I'll pass it on to Shauna just to kind of wrap things up really quickly.
Thanks, Tamir. So thank you, everybody. I want to say thank you to Tanya for being here and for sharing with us. And thank you to everybody who engaged in the chat. And fundamentally, I wish everybody the best. I wish you all health for yourself and your families in the coming weeks and months. And take care, everybody, and please reach out and stay connected. Thank you, Tanya, for being here, for sharing with us. Bye, everybody.